I'm Dr. LeRoy. I've been treating HPV-related disorders and cervical dysplasia for over 30 years. I'm doing this video because maybe in the last 5 to 10 years, I've seen a pretty good amount of bad information on the internet and how to treat HPV and dysplasia. It's kind of misinformation. It kind of gives you the idea that you can treat certain things maybe just with diet and supplements, and in some cases, that's actually going to be incorrect. So what I'm going to do is I'm going to go through and give kind of a brief overview or general concepts and how you want to be thinking when you treat different levels of dysplasia, HPV versus SIN1, SIN2, or SIN3. So if you have just an HPV infection, you have no dysplasia, there's two things you want to do. You want to prevent dysplasia, and there's certain supplements and dietary changes that help with that. And then you'd like to clear the virus, because at the end of the day, you'd like to get rid of the virus. And if you can get rid of the virus, you can achieve immunity for whatever strain that you have. So HPV only infection, you should be thinking diet, supplements, and probably suppositories. Diet, I've gone over that in other videos. It's pretty straightforward. There's only two things that have ever been shown to help with clearing HPV. And that's fruits and vegetables. So it's a plant-heavy diet. It's pretty straightforward. I have other videos on that. Supplements, I'm not going to go through specific supplements on each of these stages of dysplasia because it depends on the person. Depends on your health, depends on whether you seem to have predisposing factors, depends on your age. There's different factors that play into what supplements you may or may not want to do, because at the end of the day, you don't want to be spending $1,000 a month on supplements if you don't need to be doing that. Suppositories, there's a variety of suppositories that seem to be able to help with this. There's a little bit of research on that. Not a lot, but there is some research on that. I produce some suppositories that I like that have been shown to help with clearing HPV, so those are definitely an option. SIN1, mild dysplasia. At SIN1, which is mild dysplasia, you have more options than later on. So you're still in a pretty good position to deal with this. And you have two different options, basically, because mild dysplasia is not going to be a surgical case. If your doctor tells you that you have mild dysplasia, the doctor's not going to do surgery. Typically what the doctor's going to say is, yeah, you have some abnormal cells and we'll recheck it in 6 months or a year and it should go away. Usually they'll say, oh, don't worry about it, it'll go away. It's actually kind of not true. It's maybe 50-50. It may go away, may not go away. So with SIN1, you have a little bit more options yet as opposed to SIN2 or SIN3. So for SIN1, you could do diet and supplements and suppositories, kind of like just with an HPV infection, see if that helps. Or if you want to be more aggressive, you can do escharotic treatment. Escharotic treatment is the treatment that I recommend, definitely for SIN2 and SIN3. But if you're a person that you're like, I want to get rid of this as soon as I possibly can, well, then I would consider doing escharotic treatment instead of doing the suppositories. Now, remember the thing about diet and supplements, they do not get rid of the dysplasia directly. They do not kill the dysplastic cells, and that's different than escharotic treatment and surgery. Surgery and escharotic treatment seek to remove the dysplasia, whereas diet and supplements kind of address predisposing factors and some other underlying factors that may end up helping. SIN2 and SIN3 I'm going to group together because those are surgical cases. If you have SIN2 or SIN3, your doctor is going to give you one option and one option only, and that's surgical excision. So the doctor is either going to recommend a LEEP or maybe a conization procedure, and you can certainly do that. I mean, that is the standard of care for treating SIN2 or SIN3. There's some issues with doing surgery sometimes. I mean, there's going to be more potential side effects than, say, doing escharotic treatment. What I recommend for SIN2 and SIN3 is escharotic treatment, okay? You still want to be doing diet and supplements. So regardless of whether you have HPV, mild dysplasia, severe dysplasia, you still want to be doing diet and supplements because they're about addressing predisposing factors, okay? In general, there's two groups of people who get HPV. There's people who are going to get HPV. They're guaranteed to get cancer eventually. And there's other women that'll get HPV. They will never get cancer because they're not predisposed. So The diet and supplements are more for addressing predisposing or underlying factors. There's genetic reasons, there's lifestyle factors. Probably one of the most common sort of genetic factors that predispose you is MTHFR mutation. So people that have that mutation, which is a common mutation, they don't methylate properly, they don't utilize folic acid in doing that properly, so you can take a methylfolate or a methyl B12 and that can bypass the mutation. So diet and supplements are more about addressing predisposing factors, and regardless of what you have, you still want to be doing diet and supplements. But if you think you're going to clear SIN2 or SIN3 just doing diet and supplements, it's probably not going to happen. It's too far along, and those dysplastic cells become resistant to normal metabolic cues. So by the time it gets to cancer, cancer doesn't respond to normal metabolic cues. It kind of does whatever it wants, which is why it's hard to get rid of. SIN2 and SIN3, though precancerous, they're getting closer and closer to actual cancer, so they don't respond to the normal sorts of things that may help prevent it or maybe treat a milder form of dysplasia. So SIN2 and SIN3, you still want to do diet and supplements, but then you have only two other options, which is either surgery or escharotic treatment. Now, I talk about escharotic treatment in some other videos. I talk about it in my book, as well as talk about nutrition and genetic factors and things like that in my book. But I just wanted to put that information out there just briefly, because I get contacted by a lot of women who have SIN2 or SIN3, and they've been frustrated because they've been taking AHCC and they've been doing all these supplements and they can't understand why it's not gone. They think there's something wrong with them, and the reality is there's not really anything wrong with you. It's just by the time you get to SIN2 or SIN3, it becomes a little bit more resistant to diet and supplements. I hope you found this video helpful. Please share and please like, and I will see you in the future.